Hello, everyone. Today
Hello,
we're going to start. We are going to start very important courses in the public health, which related with the health education. The health education that means how we can upgrade the knowledge of the community or or upgrade the knowledge of the population to be more aware to prevent and protect and control themselves from the disease. One of the pillar of the public health is the health education. That means how you can upgrade or to increase the knowledge of the community. In this course, its name or let me to say the principle of health education, the basic or the principle that can let us as the students of the public health to know if you need to do the education of the community of education. What is the principle? Yeah, this is the basic. Yeah, it's the setup how you can understand the health education. This course can help you in the future when you need to raise the awareness of the community, especially during the outbreak. Right now, you are know the Sudan is suffer from the cholera or this very suitable courses here. This course also is like 2 hours in our system in the faculty. Let us to see the definition of the public health or of the health education. As I mentioned here, is the process encourage the communities and the individual to adapt with the positive behaviors that can help them to take the good decision and promote their health. This is the definition of the health education. Is the process encourage the community or individual to adapt the positive behaviors, good behavior that can protect them from the disease. This is the definition of the health education. The World Health Organization have the another definition, and also Joint Committee also he have the his own definition. Let us to go to see the definition of the health education in WHO perspective. They mentioned the health education is the comprises cons- comprises that the constructed the opportunities for learning involving some form of communication design to improve health literacy, including improving the knowledge and developing life skills, which is conducive to the individual and the community. The definition of the WHO for the health education is mainly focusing on improving the knowledge and skills of the community or the individual that can help them to protect themselves or to give to protect themselves from the disease. This is a health education definition for the WHO perspective. Now let us to see the health education definition from the joint committee perspective. They are divided. The health education is any combination of planet, any combination of planet of planet and learning experience based on the sound theory that provide individual and the group and communities to acquire the information and skill needed to make the quality health decision. This is the joint committee joint committee definition. For those, please unmute yourself. Don't noise, huh? Unmute yourself, yeah. The definition of the health education in the Adam. For those who do noise, please keep silent or mute yourself, your mic. The definition of the health education in the joint committee perspective is mainly focusing on the combination, the planning on experience learning and experience learning for the individual and the groups that acquiring the good skills and information and help them to take the good decision for themselves. This is the joint committee. Now let us to see why health education matter. Why we are studying health education. The one of the health education is a cornerstone of the public health, playing the crucial role in creating healthy society. Its impact multiple clinical areas for an empowering of the community. The why we study health education for the three main objectives. One of them to prevent the disease. When the outbreak take place in the some community, is very important to prevent the disease before this disease to affect all community or all people. Yeah. In health prevention, reducing the risk community and community engagement to aware the community about that disease and also how they can follow the good precaution to prevent themselves from that disease. Like example of the COVID-19. During the COVID-19, the main precaution it was like lockdown. No left the people to move and no moving to market and this year. All this is the precaution here. Concern for the outbreak of the cholera right now, which is top priority or burning issue in Sudan here. The precaution is like clean your hand when you are when you are back on from the market before eating, before after eating. This to clean your hand. Additionally, use the clean water, chlorination water. Additionally, eat the clean food here. This is a by this precaution that can prevent you. Yeah, this is the quality a disease prevention. Yeah, the health education mainly when you are going to upgrade the awareness of the community, we are going to give them like example the prevention from the disease, yeah, as I mentioned before. Secondly, health promotion. Health promotion for those who have the good health to keep them their health well, like encourage them to save their health good, yeah, like exercise for those have good health, yeah, to avoid them from the over nutrition, yeah, or over disease nutrition, call it, yeah. That additionally, stop stop smoking tobacco at the public place. Yeah, also to save the health of those people. They already have good health. Yeah, this is a health promotion. That means how you can promote the health for those who have good health. Yeah, this is the second pillar of health education. Additionally, empowering, it keeps the individual and with the knowledge to give them the good knowledge, good information to control themselves from the disease. Yeah, this is empowering them. Yeah, why we are studying is the question asking you why we are studying health education for three main pillars. One of them to prevent the disease, yeah, to stop outbreak, to stop epidemic. Yeah, this is a disease permission. By the health education, you can stop this one, or we can prevent ourselves or our community or our people from that disease. Yeah. Secondly, health promotion for those whom have the good health, how you can sustain this, how you can encourage those people or those community to save their health. Yeah. Last one, to empowering them, to give them the good knowledge, to good skills, good awareness, good message for them to keep them health good. Yeah, this is the call it empowering. Yeah. This is an important question. Now let us to go to next slide. In next slide, you are going to explain the core goal of the health education. What is the main objective of the health education? One of the objective of the health education increase the awareness of the community of or the people or of your when you are teach them to increase their awareness or upgrade the awareness. This is the one of the goal or objective of the health education. Second objective of health education is the change attitude and behaviors. There is a bad behavior among our communities. Like some people, like some people, they're smoking or I don't know call it what smoking tobacco. Yeah, this is a bad behavior. Additionally, there are some people no clean their hand before eating the food. Some people no care about the hygiene. This is a bad behavior. Health education help us to change these bad behaviors. Yeah, this is another objective of the health education. The third objective of the health education is enhancing decision making, like developing critical thinking and skills to help the individual evaluate the information. Yeah. Enhancing decision making, like example, if you are in the hospital or in health centers, sometimes you can meet some patient, even their co-patient also is there. You give them the education or information or awareness. Like example, sometimes some patients they prefer to use the let me to say the antibiotic more. Sometimes you can give them the awareness this antibiotic, more use of antibiotic, it is not good for your health, can affect for your kidney, and also this affect for the another things here. This can let when you are give them more information for that patient or core patient that can help them to take the good decision, that can be aware to not overdose or not use medicine in our overdose or cannot use more. Yeah. Even another example to let you to aware more or to understand well. Also, if the someone has some affected by some disease, sometimes you can give them the advice. Yeah, you have to go to doctors. You have to go to treat doctors. Yeah, because if you not go early as suitable, that means you this disease will be more complicated. Yeah, this information can let the patient or co-patient to take good decision. Yeah, the third objective of the health education, reduce the health disparities, taking towards equitable access for the vital information and also resource for all, regarding the society status. Yeah. With the health education, you can give the good awareness for the all people, even for those in the jungle bush or also in the village or in the very far place, can get the benefit. Yeah, that means no disparities for the whole community, because when you are send the message, this message or this information can be useful for with the all people. Yeah, this is the four objective of health education. One of them to increase the awareness of the community. This is the one of them. Secondly, to change attitude and behavior, or to change attitude and bad behavior of the community or individual. The third goals of health education to enhance decision making. When you are give the patient or co-patient good information about the disease or about the consume of that drugs or medicine, that can help them to take good decision from that disease. Yeah. The third objective of the health education to reduce the health disparities. Yeah. Health information, it is no all people can share it and all people can benefit for it. There is no disparities between the people. Yeah, this is a main goal or main objective of the health education. Now let us to go and see the method and tools of health education. How you can do the health education? There is a many method of the health education. One of them is the individual approach. Individual approach, that means you can give the awareness for the one person or counseling them, advise them, like someone in your community or your friend affected by malaria. You can give them the counseling, how you can treat it, how you can treat with this case here. This is called the individual approach. This is the one of method of the health education. Yeah, person by person. One person is the one patient and you. This is the call it one or individual approach. One to one. It is no many people. Yeah, give them the awareness, counseling, information. This is the one method. Yeah. Second method called it group approach. These are interactive workshop, seminars, demonstration, promotion, sharing the learning. Yeah. Like sometimes you do the symposium demonstration with the group of the people at the one place and give them the awareness. Like right now, you some gathering area like schools or hospitals can find the health educator, give them the awareness of this all these people. Yeah, many people. This is the call it a group approach. Yeah. All of people, the gathering them in one place and give them advice. Yeah, don't clean your hand, use clean water, eat clean food. Cholera, it is not good disease, can lose your life within the some many with some hours. This is a call it group approach. Group of the people at the same place like class or like a hall or like shelter, and give them the message. Yeah. This is the call it group approach, group of the people at the same place. Yeah. The third method of the health education called the mass approach. Mass is the population, many people. Public approach, campaign, strategic use the traditional and digital media and widespread. Yeah. Sometimes people can use in the television. Like many million of the people is going to see that message during the Facebook, WhatsApp groups. Yeah, like million of people can see that post, can see that video, can see that this is called the mass approach. Yeah. This is a three method for health education or three approach. Sometimes we can call you method or approach. Yeah. One of them individual, person by person. Second of them group approach in shelter, gathering people in some place and give them the awareness. Third approach called the mass of the population, big population as the can give them the message. Yeah. This is the method call it this is the method of delivery of education. Last one, let us to see the essential tools here. The tools can help us to send the message or to do the health education. One of them, visual aid, like poster. Can put it in poster there and write your awareness here. Poster and chart and flip chart and clean visual communication. This is the visual aid you can see by your eyes here. Poster and also chart, flip chart, all of this call it the visual aid. Visual aid can help, yeah, can help you to send the message, yeah, or aware of the people. Second thing, the audio visual aid, audio that can your hearing and visual can see. First one, the visual aid, the aid can help you to see, like poster, you can see it. This is the call it visual aid. And second one is the audio visual. Audio you can hear it and also can see it, yeah, like video, like video. Is it visible? Who's do this? Zero one audio you are did. Okay. The second tools that we are using in health education is the audio visual. That means audio can be audible and also visible, can you can see. This is the two, yeah, tools here. As I mentioned, like video you can see it and also you can hear. Other third tools can put it printed material, informative, or call it IVM, or like there's some, yeah, informative lists and booklet and also, yeah, reference, yeah. This is like book, yeah, or can booklet can small papers like in one page can send, write your message and give, send to and give to the your population. Yeah, this is a call it printed material. Is a booklet. Yeah, is a small and be, yeah. This is also tools of health education. Last one, digital tools like mobile apps. Yeah, some people, there are some application mobile and also website. Like example, if you need to awareness of the cholera, there is some apps you can see, tell that and can get your awareness like that. Yeah. Additionally, website is also digital tools. Yeah, you can go through the website and also you can see the information, awareness of the community, awareness about some disease. Yeah, podcast. Yeah, podcasts. Yeah, like presentation, one paper can one person and as someone to explain podcast. Yeah, all this, yeah, this is essential tools for the health education. One of them visual, you can see our your eyes. Yeah, Audio visual like video, you can see it and can you hear. Third one, printed material like a page, write the awareness and send to the people. Last one is the digital tools. This you can Facebook and also yes, yeah, you can find in Facebook. Yeah, this is the essential material. Now let us to go to next slide. Now let us to see the communication process. The communication process in health education is very important to attend to understand this process. How you can do education. The process is very important. Yeah. Effective health education, hiring on robust communication process, ensuring the message are accurately invoiced and receive it and understandable. Yeah. The good health educator is very important to understand that message is clear and also good transfer and good receive. Yeah. This is very important. Additionally, you can see in the health communication process, there is the one is called the sender or educator. This someone is the sender message. Second is the message. That the message you already have awareness session, awareness precaution of the cholera. Last one channel. Channel how what's the way you are going to send them this message here. This is the channel through the message, traveling, verbal, written, or this is the call channel. Receiver. Those people they are going to receive this message here. Last one is the feedback. Those people who are receiving is understand that message. This is the communication process. There is a five. One of them send. Second message service is the channel. Four is the receiver, and also you can see the feedback here. Now let us to detect the health education method. The didactic method are structured teaching technique from the backbone of the formal health education setting and emphasizing that one of them lecture like right now we're in lecture tell demonstration. Demonstration also is the health performance like proper hand washing or practical showing, like on job training, can let them to be aware the people how you can clean their hand. Case study in depth analysis of real life health scenario, develop the critical thinking problem and solving. Also case studies, there's some example about the outbreak, how you can use to education, Last point, the problem-based learning, how you can learn from the problem, During the outbreak, like cholera, is very important for us to learn from it, Collaborating group work to solve the complex relation problem, You can set if there's some health issue or health problem, it's very important to sit together and think how you can solve. This is the detected health education method. As I mentioned, one of them lecture and demonstration, case studies and problem-based learning. Now let us to go to last slide for the lecture of today. The last slide you can see here, health education is an indispensable discipline, fostering individual well-being and community continuous journey knowledge dissemination and skill development. The conclusion of this lecture, the health education is the discipline can improve the skills and knowledge of the individual and the community that can help them to adapt their behavior with the good knowledge and good skills here. Uh, Key takeaway: health education.
Teacher, you are muting yourself.
Okay, thank you. Concern for the conclusion, health education is a indispensable discipline that can fostering the individual and community with good knowledge and also good skills that can let them to be good adaptable with the good health behavior and protect or control themselves from the disease. Yeah, this is the conclusion. Health and also there are two key takeaway: health education, empowering through the knowledge and skill building and fostering healthy behavior via good communication strategy. With a good communication, we can upgrade or empowering health of the community and also health of individual. Looking for our next session, we will advance technique here. Thank you for you, or thank you for your attending this or the lecture of
Thank you so
today.
much.
I will share this video. I will share this video with all team in the YouTube. Then I will share it in the platform, and also the material will be there. Thank you a lot. If there are any question, please raise your hand or comment. If any question, if no question, I will tell you thank you and take care. Have a good day.